All right, let's talk a little bit about what we call the mirror image postural exercise. This is a basic exercise that we prescribe to a lot of people for a very common posture nowadays. The posture that a lot of people have is called sway back, where their chest leans back compared to their hips. It's a very common postural fault that can cause some pain and dysfunction if not corrected. So we want you guys to start doing some more postural exercises at home, at the office, on the road while you're traveling, etc. And I'm going to quickly demonstrate what that postural exercise should look like. In fact, I used to have this posture, so I've done thousands and thousands of these exercises. Now, the way that I used to do it was seated. You can do it sitting in a chair. You can do it sitting on a football, which is my personal preference. And let me scoot you over here so you can see me. What we want to do is we want to take the chest and we want to mirror image it compared to the hips, meaning we want to put it in the exact opposite position that it would present on your posture picture or on an x-ray. So if the chest goes back, in order to rectify that situation and improve your condition, we have to spend some time with the chest forward. We call that the bent coat hanger theory. So if the coat hanger is bent one direction too far, in order to straighten it, sometimes you have to bend it slightly past neutral, and you have to do that a few times in order for it to actually get straight. So it's kind of the same thing with your posture and this mirror imaging concept. Now the good news is you can do this at work and get paid to fix your posture. So what we want to do is we want to simply put our hands on the knees here, and we're going to almost use them as leverage and kind of pull our chest forward and stretch this out. Some of you may hear some clicking and popping as you stretch the joints of the back. You may not. You may feel a little bit of a strain, but that's the area that we're working on, and that's all good stuff. Okay? Now, typically, just like your mirror image head exercises, we would do this for a count of 10, 20, or 25, and then we'd go back to work or go about our normal day and come back and do another set of 20 or 25 shifting forward. Constantly resetting your posture in this way, like with your mirror image head exercises, is what actually leads to a postural change or a change in the alignment of your core, your spine, without actually having to brace anything, putting a brace on, or rods and screws like dentistry, etc. So if we've prescribed this exercise to you, it's very important that you understand it and you follow through with the frequency and recommendations on how many times you're supposed to do this per day. And if you have questions about this exercise, am I doing it right? Am I supposed to feel this? Just ask a member of the office next time you're in, and we'll make sure you're doing it right, and if not, we'll correct it. But once again, we're trying to pull the chest forward, keeping the chest straight. We don't want to lean forward. That's a different movement altogether. And we also want to keep the head up at the same time. Okay? Like I said, I've done thousands and thousands of these, and if it's been prescribed to you, you're probably going to have to do a few thousand yourself.